Hi, it's the nursing professor here. Today we're going to talk about respiratory medications, especially respiratory medications you use in an emergency. So before we begin this video, I want to encourage you to like and share this video. It really does help the channel. So our last set of videos that we talked about were cardiac medications, and cardiac and respiratory kind of cross over each other. And so I want you to always keep that in mind, because many of the respiratory drugs that we'll talk about, they will elevate the heart rate of a person. So you have to be aware of that. So first on the list is albuterol, of course. Albuterol gives you the fastest relief, opens up the airway, and that's typically the first line of drugs that we use for a person who is having some difficulty breathing. Side effect, though, is tachycardia. Next on the list, and frequently they're used together, is the ipratropium, which dries up some of those secretions. So again, with lung disease, then typically you will get closure of the airway as well as excess secretions. So albuterol with ipratropium really does help work together in order to resolve some of those symptoms. Next on the list would be steroids. Those are things like your solumedrol, your prednisone, which help to decrease inflammation in the lungs. And so when you're using those, then you want to be aware that you want to taper the dose. You don't want to abruptly stop it. So if you're using prednisone and say a person starts at 40 milligrams, then you taper it down to maybe next 30 milligrams and 25 milligrams and 20 milligrams. You just don't abruptly stop it. Now, with any of the inhaled medications, especially those with any type of steroid in it, you want to make sure that you're educating your patient to rinse their mouths out, because that medication can sit on the tongue and it really can create a mess in a person's mouth. So you want to make sure they are aware to rinse their mouths out after administering any of those inhaled medications. Now, another drug that is frequently used in a case of emergency, that's really an old drug, is theophylline. Now, with theophylline, we have to be aware that there is a acceptable range. And so a person can get a toxic dose of theophylline. So we want to know what range or what value that person has. So think caffeine overload. So frequently when a person is getting theophylline, we don't encourage them to take caffeine at all, because we know that that's going to elevate the person's heart rate as well. So we always want to check and know the levels of a person who is on that drug. So breathing meds can affect the heart too. So we want to always be aware of that possible interaction and look at both of those vital organs simultaneously as we're treating the person for any type of respiratory problem. So I hope that helps, that these last 4 videos will help you get prepared for your final exam. So let's review them real quick again. We've started out talking about the ABCs. So you want to know those: airway, breathing, circulation. We talked about normal, abnormal electrolytes and the importance of knowing those. You want to know that. Then we went into priority, like Maslow's hierarchy of needs, looking at a person that was stable versus one that was unstable, looking at changes in level of consciousness, making sure that if a person shows any change in vital signs, that is a person who needs to be seen first. And then we moved into cardiac medications. You should know those. Remember your beta blockers, your ACE inhibitors, your ARBs, digoxin, be aware of those. And then last but not least, we went into your respiratory drugs, including those that you use in an emergency, like your albuterol, steroids, knowing that you need to taper those drugs off as opposed to abruptly stop it, teaching your patient how to rinse their mouths out after they use those drugs. And theophylline, knowing that theophylline is a really good drug. It's an old drug, but you definitely need to know lab values to make sure your person is not getting a toxic dose. So I hope that helps. I will see you next video. Good luck on your exams. Bye for now.